Hi, and welcome to my presentation on amphetamine. In this presentation, I will provide an overview on what type of drug amphetamine is, what drug class it belongs to, and what it is indicated for. I will discuss the pharmacokinetics and the pharmacodynamics of amphetamines. I will also discuss the role of the interdisciplinary team, the scheduling of amphetamines, who can prescribe the drugs, and some harm minimization strategies. And finally, some counselling considerations when working with a person prescribed amphetamine. What are amphetamines? Amphetamines are a group of psychostimulants belonging to a drug class known as central nervous system stimulants. Amphetamines stimulate activity in the central nervous system and elicit messages from the brain to the body to speed up. This action results in an increase in mental alertness, increased motor functions, and a euphoric-like feeling, as well as decrease in fatigue. Due to the rapid euphoric effect and addictive properties, chronic use and misuse has a reported high occurrence rate, which leads to drug tolerance, drug dependence, and drug abuse problems. Amphetamines are medically indicated for the treatment of attention deficit hyperactivity disorder, narcolepsy, and in severe obesity. Pharmacokinetics. Absorption. Amphetamines are usually administered orally, but they can also be taken recreationally via intranasal, injected, and inhaled. Amphetamines are rapidly and well absorbed in the gastrointestinal tract with a Cmax of 120 nanograms per mil and a Tmax of 2 hours in a person with a normal range BMI, or approximately 15 minutes post-injected. It presents with a bioavailability of over 75%. Distribution. Distributed to body tissues via transporter proteins of monoamines with high concentrations in the brain, cerebrospinal fluid, lungs and kidneys. Apparent volume of distribution of 2 to 3 litres per kilo with a normal range BMI. Metabolism. 30 to 40% of amphetamine is metabolized in the liver, mainly by the action of hydroxylated enzyme CYP2D6. The remaining 60 to 70% is excreted by the kidneys. Elimination. Amphetamines and their metabolites are almost fully eliminated in urine, with 40% excreted unchanged by the kidneys. Elimination is pH dependent with a half-life of 16 to 31 hours in pH greater than 7.5 and a 6 to 8 hours in pH equal to or less than 5. Approximately 90% of the oral dose is eliminated 3 days post-administration. Pharmacodynamics. Amphetamines bind to transporter proteins from monoamines to increase activity in monoaminergic systems. Once entering the nerve terminals via these transporters, amphetamines work on disrupting storage vesicles of dopamine. This results in an indirect sympathetic action where the direction of dopamine and noradrenaline is reversed. Ultimately, this releases an abundance of stored dopamine and noradrenaline. These actions elicit the effects of euphoria, locomotor stimulation, mental alertness, anorexia, and stereotype movements. The efficacy is 95% effective when used as prescribed, dose and time dependent. Listed on the humanoid are some of the more common adverse reactions to amphetamines. Interdisciplinary team. Scheduling. Medical amphetamines fall under Schedule 8, controlled drug, where substances that may produce dependence and addiction. However, recreational amphetamine fall under Schedule 9, prohibited substances, where the manufacture, possession, sale, or use is prohibited, including heroin and amphetamine derivatives. Prescriptions. Pediatricians, psychiatrists, and neurologists can prescribe amphetamine-related medications with validation and approval from state or territory health department commissions. Pharmacists can dispense and provide information on administering medications, the side effects and risks associated with dependency and abuse of amphetamines. When working with a person who is prescribed amphetamine, health professionals can work with them and assist in minimizing some of the psychological and physiological effects and provide strategies to enable this. Some examples are assisting with nutrition, sleeping habits, and hydration. Some counselling considerations. Take orally daily in divided doses as per prescribed with or without food. It's best to take it 6 hours prior to bed to avoid any sleep disturbances. Some of the more common side effects are headaches, insomnia, decrease in appetite, changes in mood or behaviour, sexual dysfunction, nausea and vomiting, diarrhea or constipation, and dehydration. Mild symptoms usually go away within a few days, but if symptoms persist or any concerns, talk to your doctor or pharmacist. Drug interactions and warnings. Avoid caffeine-based and energy drinks. The combination of these two substances can lead to an increase in blood pressure, stroke risk, and heart attack. Mayos increase the risk of adverse reactions and toxicity. Ensure therapy is ceased 14 days prior to commencing amphetamine medication. Drug dependence. Give cautiously to people with a history of drug dependence or alcoholism. Chronic abuse may lead to tolerance and dependence. Test your knowledge. Question 1. Answer. Question 2. Answer.